For Action News, I'm Anna Smovska. Picture this, a hospital running low on general anesthesia. Doctors administer insufficient doses, and a patient awakens in the middle of surgery. Cancer patients told they can't complete their chemotherapy treatments because a drug ran out. And an intubated woman with not enough IV sedative tries to pull the breathing tube out herself and bites off a piece of her tongue. These are not horrible scenes from a horrible movie. They're happening in hospitals nationwide. The names of the drugs change, but the story is always the same. It all began with the Medicare Prescription Drug Improvement and Modernization Act of 2003, implemented in 2006. This graph shows the staggering numbers.
You'll see that this thing starts sharply in 2006, which is exactly when the Part D of the 2003 law kicked in. And you see a very small number of drug shortages going up to a very large number. And if this is a coincidence, it's a really big one. Now, there are other people that blame these so-called purchasing organizations, maybe gray market organizations, which, knowing that there's a short supply of certain drugs, will buy them up and then sell them at huge profits to hospitals that are desperate to get them. I'm sure this is going on, but this again goes back to the fundamental problem. Not enough manufacturers making enough drugs.
Today, 8 years after the crisis began, we have a significantly reduced supply of commonly used and life-saving medications like saline, dextrose, morphine, IV sedatives, and general anesthesia. Most recently, shortage of nitroglycerin given to heart attack patients in the ER. It's
pretty disturbing that if you go to the ER with a heart attack and they're out of nitroglycerin, this is Mad Max we're talking about here. This is just standard care. I think maybe most affected are cancer patients, because there are about 500,000 cancer patients that were affected by drug shortages. And in some cases, they had to switch to other regimens that were not as good. And in some cases, there was nothing to replace the drug whatsoever. And this included kids with leukemia and adults, and it was a disgrace.
It's a harsh reality, but all of these scenarios stem from the same problem. Price control leads to shortages. Companies exist to make money, and the drug industry is no different.
Especially IV generics, which have a very low profit margin to begin with, were faced with price controls, and a lot of companies said, you know what, it's not worth it. We're going to lose money on this, or we're not making any money, and they dropped out, in some cases leaving 0 or 1 manufacturer. Because of a directive from President Obama, there were new regulations that the FDA was able to use, and this required companies that were anticipating a shortage or discontinuing a drug to inform the FDA so that the FDA could then look for other manufacturers and try and head off the shortage. And to some degree it's worked, but if you look at the graphic, you'll see it hasn't worked all that well, because new shortages still are happening and the old shortages pretty much remain as they were.
To read much more on this topic, we urge you to head to our website, acsha.org. That's acsh.org. While you're there, don't forget to also sign up for your daily dose of news delivered right to your inbox. For ACSHA, I'm Anna Smovska.